Hello, this is Full Circle. My name is Arthur Dashin, and I'll be the moderator at this table today. To my right is Philip Shatton. To my further right is Adam Ando. To my left is Henry Macias, who is a biology major, a public health minor. He's our guest speaker for today. And to my further left is Devin Sandin. Adam Ando will introduce a gridlock topic for today, which is the controversial topic we will all be debating about. And later on, Boyan Boyanov will come in and introduce the button, which will be the hot topic that we will be discussing. So we will start with the topic that our guest speaker will start to bring up, which will be healthcare. So we will start with the topic that our guest speaker will start to bring up, which will be healthcare.
All right, guys. Well, the first thing we're going to be talking about today is Affordable Care Act as of 2010 and the recent decisions in the courts that have been made over the past couple of months. And we're just going to talk a little bit about how you guys feel and like whether this follows our Constitution and whether our rights as people of America are being violated.
So I think that's completely unconstitutional. The exact wording of the Healthcare Act says that they quote use the word penalty. They will penalize anyone who doesn't specifically have health insurance. So that's completely unconstitutional. Nowhere in the Constitution does it say the government can penalize someone for not buying some product.
However, the Constitution does grant Congress the power to regulate interstate commerce, A. B, they're enforcing it through the IRS, I believe, which would fall under their tax powers as granted by the Constitution. So what specifically about the phrase penalty or a negative tax incentive makes it different? What makes that unconstitutional?
First of all, it does not say tax anywhere. It says penalty. The government will issue a penalty on someone who doesn't have health care. So legally speaking, if you read the actual act, it doesn't say tax. It says penalty. A person can assume it's a tax, but no matter even if a person assumes that, it's still not a tax. It's legally a penalty, a government penalty on a person for
if
not buying
it's enforced through the tax
product.
policy, how is it different from a tax? Even if it's phrased slightly differently. Two laws are phrased slightly differently but have the exact same effect, exact same enforcement. Are they different? Is there a constitutional difference between the two laws?
Well,
I would say no.
A tax doesn't force anyone to buy something.
Also, neither does this. You can just pay the fine or tax instead.
Healthcare is not always interstate commerce, and under U.S. v. Lopez, the court really regulated the Congress's power to stop interstate commerce.
That's true. They've strictly limited what they will consider to be interstate commerce. However, the fact that some insurance policy isn't interstate doesn't mean that the market as a whole isn't, because it definitely is an interstate market.
I think the big problem that we're seeing at the moment is, well, first of all, the wording of this bill and how like it's directly affecting the Constitution. But what about how it's affecting the people directly? I mean, think of who is this bill affecting directly? It's definitely not affecting the rich class because, well, the rich. Is it affecting the middle class or the poor? Because the poor obviously don't have healthcare for the reason that they can afford it. So are we really going to start imposing healthcare on people that can't even pay for healthcare itself? What do you guys think about that?
I'm just going to note that this is a matter of whether it's good policy or not, rather than dealing with the constitutionality directly. However, with regards to public policy, it's a good idea to have everyone have insurance because A, it's spreading the risk rather than leaving it to individuals who probably won't insure themselves and therefore will cost everyone as a whole. A. B, it causes positive incentives of causing people to get preventative care rather than waiting until something goes wrong before having to get it treated, which causes a benefit from a utilitarian perspective by reducing overall healthcare costs.
Devin, do you know how much the penalty is for not having health
I believe
insurance?
$750.
Now, if you're a very poor person, say making under $20,000 a year, and you have to support a child, and then every month, because you don't have health insurance, you have to pay an extra $700. You can barely afford food and rent costs as it is. Then how do you think that would affect those people?
I mean, I'm just going to say, with regards to that, the idea is that if they're forced to have it and they make below a certain amount of money, then it's their employer's job, in which case, and I don't know the exact specifics, so correct me if I'm wrong on this point, but if that is the case, then that would actually do, to a certain degree, the opposite of what you said. Instead of necessarily spreading the cost, it would centralize them so that you have businesses only paying it. And I think, when you think about it in the abstract, like, oh, Walmart can afford to pay a few billion more dollars for healthcare. That might be true. But when you look at the small businesses and the amount that they have to pay, then it just ends up hurting them and their employees. I agree people do need health care. I think everyone should be insured. That would be great. But if doing that would cause more long-term damage, then I think we have to look at our priorities and think more long-term.
And I also think, just on a quick note, that this directly affects how Congress writes the policy, because it is affecting the Constitution. And I mean, you have to think about why this bill was made. It's for the people. So it directly, I mean, how it's written and how the logistics of it are effectively connected to how it's going to affect the people, because that's why the bill was made in the first place.
Also, you must realize that you cannot force someone to buy something. They don't have the right to compel people to purchase a product. Now, they have the power to regulate. They can prohibit you from doing certain actions, but they kind of compel you to do an action.
Okay, I'm going to bring up a fairly common analogy, which is to compare this to car insurance. How do you respond to that analogy?
Car insurance is conditional. You have to get it if you want to drive on the road. This is not conditional. You have to buy it or you get penalized. There's no, they're not. You don't have to buy this to live. Like they kind of compel you to buy something in order to be a human being.
You have to buy this to use the hospital system.
We can just deny them to use the hospital system.
I mean,
churches used to cover that.
Exactly.
People go to the hospital all the time and just pay. Like if you need a vaccine, they can just pay it cash. And I understand like there's some other logistics behind that, but my main concern is just like, can we really penalize the people for not wanting to buy this health insurance that is mandatory by the government? I mean, is that constitutional?
And frankly, most people don't even need that much healthcare. I mean, how often do people end up going to the hospital? For a year, the amount that they pay for an insurance is usually far less than what they actually need for it.
Well, yes, but the purpose of insurance is to spread the risk. You go through paying more than you're likely to pay on average, but the worry is that if you get something very, very bad that you can't pay for at all, you get a massive bill. So this is taking that massive bill and dividing it between everyone, so everyone's okay rather than someone getting completely wrecked.
But the people who are most affected by it, the ones who have to pay the fine because they can't afford it, they're the ones who get screwed the most out of it. How does that help them?
Okay.
That's the least of their worries. They're just trying to survive on a day-to-day basis as it is.
Getting back to that point, specifically within the bill, I believe you brought up that it's supposed to be covered by employers, but that kind of causes problems for small employers. However, I believe that the bill specifically deals with that and gives tax credits to small businesses because they understand that could cause trouble for small businesses as opposed to the larger ones. So the structure is very, very carefully set up so that it's not going to cause problems for the middle and lower class. Does everyone understand what I'm saying there?
Mm-hmm.
Okay.
On going based off of that, I mean, I guess you have to. I agree with your point in saying that people usually pay more for health insurance than they actually use it. I mean, think about us as students. We're mandated to get the school insurance if our insurance doesn't cover a certain cost here at the university. So I personally believe that's always been unconstitutional. If like they're charging me for this insurance just because mine isn't good enough. That's pretty much what they're doing here with this new law that they're trying to pass.
But the difference is this is also conditional like car insurance. In order to go to this school, you have to get it. But it should not be a condition to live in a nation. You have to buy this. It should not be a condition to live in a state.
Oh, one other thing to bring up. You were talking about how you have to pay more for insurance than you would on average for normal costs, which is because there is administrative overhead in the insurance companies. However, a lot of that overhead comes from inefficiencies in the companies because there are state-by-state monopolies and laws against companies selling for the same prices across state lines. So what this law does is it breaks down those barriers to make the market more efficient and decreases those monopolies. So we should see those overhead costs come down and therefore the prices come down as well.
I doubt it. People because people respond to changes very quickly. So most likely, I would say they would somehow respond to that. So it will probably still end up costing about the same.
So,
I don't think it would
So are you saying
change
that a free market
substantially.
won't have any effect on the prices, Mr. Libertarian?
It'll have an effect on the prices, but the monopoly is greater than just an insurance company. Drugs in general, pharmaceutical drugs, there's a monopoly, and that as a whole. So even if you slightly deregulate, for example, how you make What exactly were you saying? Make
States
more...
can't sell at the same prices across state lines, which means you have within state monopolies essentially. So one state will only have access to say 3 companies, and therefore those 3 have a monopoly within themselves.
There's still an overall monopoly even above that.
Well, there are multiple levels of monopoly between the health industry itself, as in the pharmaceutical companies, but we're destroying one monopoly which should have a fairly substantial effect in reining in prices.
I wouldn't say it'd be that substantial. It might lower them a little bit if anything, but still
Well,
more people get screwed and helped by it.
It lowers the overhead costs of insurance, which is the only point I was making. I'm not saying it's going to cut the cost of healthcare as a whole. I'm just saying it's going to cut the cost of insurance itself.
So, I mean, if it's not gonna cut, if it's not gonna cut health insurance,
No, I'm saying it is.
well, or, I don't know. I guess we have to see like how this is. I guess we can't really calculate or logistically say this is gonna save money here and here until we actually see it.
Actually, Congressional Budget Office did do that math and said that it is going to save.
And look, okay, not to like go on a tangent here, but they were calculating our economy for the past 5 years, and look where we're now.
Okay.
I
so
mean,
They don't
I have to
actually
agree.
calculate the economy, they calculate the effects of legislation.
I mean, but
Okay,
still,
so
we're kind of screwed.
we're starting to run out of time. So I guess could we just quickly go over real quick if you want to summarize what you're saying just very quickly. My basic point of view is I don't have too much, but my main concern is the economic effect of this bill. If, as you said, if what you said is true and they can in fact prove and they have taken the proper provisions that the healthcare effect will not do serious damage to the economy and may overall help it, then I would be willing to support it. If you could definitively prove that. That's what I'm saying. So if you just want to quickly go around, but we don't have too much time left for this topic.
I would say that just with the wording of the bill, it's unconstitutional. That's what we started discussing at the beginning. Not whether it helps people, whether I don't think it'll help all the poor people, as I mentioned. But overall, because of the wording of the bill, it's unconstitutional. If you word it differently, maybe you could make it constitutional. But the way it is now, it's not.
I personally think I'm just taking a very scientific look at this statistically, and I think it's unconstitutional just because of how it affects people directly, with like healthcare wise. So that's just my point of view. I may be wrong. Like I guess once I sit down and see the logistics of it, like money wise. But until then,
I believe that it is constitutional, and I believe that it's relatively good policy in as much as politics is the art of the possible, not the ideal. Compromise is inevitable, and this isn't the best bill we could get, but it's the best we did get.
I believe that the bill itself may be beneficial, but they must remove the penalty from the bill. And the court ruled that mandate is severable, so the bill itself is not unconstitutional if you remove that specific
Well, that's
piece.
one specific court. There have been 4 decisions so far.
Alright,
We can
well.
cut that part.
Okay, so that's the end of our first topic. The next topic.